People can think that I'm sneaky, manipulative.
Reckless all the time.
I have no skills or ambitions.
Can I catch it?
I think there's something really wrong with the term borderline personality disorder because it suggests that maybe I'm a bad person or that I don't even have a personality.
I hear voices with my schizophrenia, and people think it's easy to just challenge the voices and tell yourself to ignore these voices.
This image of being in a film such as One Flew Over the Cuckoo's Nest, that you lost control, that's also everybody's misconception of what bipolar disorder is.
The reality of my illness is that it can be really hard work.
You can have mood dips, you can have mood highs, but it can be controlled.
Every day I have to challenge myself and my voices and tell myself that I'm better than my voices.
I am very fortunate to have the support of my wife, and she stood there and stood up for me when other people wouldn't.
I have a good friend who I've known for years. He then told me he'd be there with me throughout it all.
You can have a great job. I've had an excellent career.
You have family, you can have friends.
So you can be functioning, you can live a healthy life if you have the right help.
Good evening to everyone. Good evening. I hope everyone is doing well. I hope everyone is doing fresh. My name is Sky Kedevese, and welcome to the Impact Show. I know everyone has been waiting for this day. And yes, man, I promise, and this day has came. We're going to talk about mental illness. We're going to talk about mental health this whole weekend. So I hope that we are going to be here and we are going to learn and we are going to take note and we are going to change life one motivation at a time. I always say that in each and everything that we do here, you might not be affected directly, but what we give you or the content or the information that is going to be shared to you, you are able to pass it on and be a change in the world and be somebody who's going to inform somebody who does not know or who really isn't sure about mental illnesses. And today I have my guests today, and I'm just super happy that they have taken their time out of their busy schedule to join us, because I know we have busy people, because during this pandemic and everything that is happening, they've been within and they've been trying their best also to work and change life in their respective fields. And yes, so before we start, I just want to introduce them and see with you who they are, what they are doing, and why they are doing it. You need to understand that. So I'm looking forward to it. I am going to add my first guest, which is Maxine. Yes, she's my friend, from way back, and she has been helping with a lot of things, personal things I cannot say. Yes, and yeah, let's add her into the stream, and yeah, and let's see what's popping. Hi, Maxine.
Hey John, how you doing?
I am good. I'm good. So tell us about yourself before we start.
Okay. So first of all, hi to everybody who is, watching. My name is Maxine, as John has said. I am a final year occupational therapy student. And so the reason I studied occupational therapy is because I really realized that I have a passion to help people, especially people with disabilities. So usually when we think about people with disabilities, we think of somebody sitting in a wheelchair or somebody who's using a cane to walk, But occupational therapy also deals with a very important aspect of disability, which is mental health disability. And so, yeah, that is my passion. And I just love helping people.
Oh, that's nice. I always tell people that in life we're all about helping people. It's either you're a doctor, it's either you're fixing somebody's car. Generally, we're all about helping people. And I just say that what, it is good that you are helping people, and that's an incredible thing. That's a very much incredible thing. So today, as we're going to talk about mental health, I don't know what you want to tell us. I want it to be a surprise to me as well, because I have this tendency of speaking too much. So I want you to tell us I want you to tell us, okay, what will you be telling, or rather talking to us, for the 45 minutes? I don't know. You will tell us, and yeah.
Okay, so the topics that I'm particularly interested in sharing include anxiety disorders, which in that contains because OCD is one of the anxiety disorders, and also I would love to
Mhm.
touch on the autism spectrum disorder. But that's for because we have a 3-day talk, so that's for later on in the 3-day talk. But
Yes.
tonight, I'm just going to start a little bit on anxiety, and then hopefully, Kholi will then come in, and then she'll just link how anxiety leads to stress, and then the issues related with stress, such as depression and suicidal thoughts. So that's basically what today's session is going to be about.
Okay. That's interesting. I seem amazed, and I have my own questions I'm going to ask. But I just want to say to everyone, to anyone who is watching, I want to say to you that if you have a question, if you have something to share, feel free to drop it on the comments. We'll read your comments just about when we end the show, and we are going to talk about it. So before Maxine starts, I'm just saying to everyone that thank you very much for joining us. And yeah, we are within, and let us start with the take it away.
Okay, so the first thing that I'm gonna basically start on today is anxiety. Uh, okay, first of all, disclaimer: I need to let it be known that I am not a psychiatrist. I do not have the capability to diagnose anyone. The information that I'm relaying is
Mhm.
stuff that I have learned in my studies and also stuff that is available on the internet as well. And I need to also make it very, you know, blatant and apparent that if you do suspect that you might have some of the mental health issues that we're going to talk about, you have to have an official diagnosis from a psychiatrist. Just disclaimer before we start. Okay, so basically, I'm going to start talking about anxiety. And before we start, I want us to all just take note of the fact that it's normal to have a certain degree of anxiety towards life situations, because that type of anxiety basically works to keep us safe. So, for example, when maybe you're scared of dogs and then you're walking down the streets and here's this massive dog and it starts barking at you, and you can see with you, oh, I'm going through everything. So you're going to get a certain level of anxiety, and that's normal. That's not the type of anxiety disorders that we're talking about here today. né? So that type of anxiety that I just spoke about is basically associated with your fight or flight response, which is basically a response that determines whether you run away from the threatening situation or you confront the threatening situation that you're facing at the time. So the anxiety disorders we're going to talk about today, there's basically 6 main types or 6 categories of anxiety disorders. Those include phobias, they include panic disorder, they include generalized anxiety disorder, obsessive compulsive disorder, acute stress disorder, as well as post-traumatic stress disorder. So they all are very different from each other, and they have different presentations basically. But the main thing that they will all have is that when you experience these type of anxieties, then you will experience irrational rather, and excessive fear, apprehension, or tense feelings. You'll have difficulty just managing your day-to-day tasks, and it'll be because of the stress that you're feeling, basically. So when you have anxiety, you can have different manifestations of it. So it can either manifest itself in a cognitive way, which basically means mentally. It can manifest physically, which is physical symptoms of anxiety, and it can also manifest behaviorally, which basically says that the way you're acting or behaving is unusual from the way that you would normally act or behave. So when you have cognitive anxiety symptoms, this is when the attention shifts immediately and automatically to the potential threats. So the effect of your thinking then ranges from mild worry to extreme worry. And then when you have physical manifestations of stress, these effects basically are physiological. So you might experience things such as palpitations, you can have an increased heart rate, you might find yourself experiencing shallow breathing, trembling or shaking. You might find yourself having sweating, dizziness, or lightheartedness, as well as a weak feeling in your knees. Sometimes people might end up freezing, and some people even go as far as having nausea and vomiting, as well as dizziness and shortness of breath. Yeah? So, because I've stated before, Wuti, there's a normal, range of anxiety or normal degree of anxiety in your life. It's important to note when this anxiety then becomes a problem. How do we make the definition between I'm just experiencing normal day-to-day anxiety, or I might be presenting with the symptoms of a anxiety disorder? So when you are basically experiencing symptoms of an anxiety disorder, the indication for the cognitive symptoms include anxious thoughts, ne, and anxious predictions. So I don't mean just like yo, Linja is on gloomer, but something that is excessive, as in it interrupts your day-to-day life. As in when you wake up, the first thing on your mind is, I'm so worried about what if I walk outside missing stress mode. And at Benny, there was no indicator to be like, the car in the street might be a hazard today. So it's excessive worrying, and it's also not important to note that it's persistent. So it's not like one and then you're like, oh, I had one anxious thought today when I woke up. Maybe I have an anxiety disorder. It's persistent and it happens throughout the day. For the physical manifestations of stress, it's excessive physical reactions to the environment. So when you have that nausea, when you have that dizziness, and even vomiting or even fainting sometimes, it's excessive. So when I say excessive, it means it's not proportional, or proportionate rather, to the threat that you might be perceiving. So there's nothing that is threatening enough for you to be having such extreme physical reactions. And it's also important to note that you don't just get anxiety disorders or the symptoms of anxiety disorders just because there's something threatening. You might be having a totally normal day or a totally normal life, and you present with these symptoms. So, you don't really have to have a stimulus or a threat for you to experience anxiety when it's an anxiety disorder, that is. For the behavioral part of things, where you might suspect that it's becoming an anxiety disorder is when you have then avoidance of those specific situations. So, for example, if you are nervous about driving, you find yourself in a situation where you avoid any activity that is related to driving or that can lead you to end up driving. And so I think it's important to note that that's really when the anxiety becomes a disorder, when it's hindering you from participating in your normal day-to-day activities. So something that you'd usually do, all of a sudden you cannot do just because it's that threatening to you, it's that stressful to you. When you just think about it, you can feel your body having reactions to just the thought of doing these things. Ne? So there's certain things that must be considered when you're determining whether or not the anxiety that you have needs you to consult medical professionals or not. So the first thing we need to consider is the degree of distress that is caused by the anxiety symptoms. Ne? So how stressed is this thing making you? How anxious is this thing making you? How hectic are the symptoms that you're experiencing? That's the first thing we need to consider. The second thing we need to consider then is the level of the effect of the anxiety. So how deeply do these symptoms then affect a person's ability to work, to study, to socialize, and basically engage in activities that they would normally engage in? So that's basically almost like a summary to just general anxiety, because anxiety is a very broad topic and there's many different types of anxiety disorders. So the first anxiety disorder that I'm going to talk about is called panic disorder. So panic disorder basically involves repeated and unexpected panic attacks, which are associated with or present with heart palpitations, sweating, and trembling, and they must be followed with at least 1 month of persistent concern about having another panic attack. So if you have a panic attack today, and then you have all the associated symptoms, palpitations, you have sweating, dizziness, and and you have a full-on panic attack, and you have that, and then you spend the next month excessively worrying about the prospects of having another panic attack. That is when we start suspecting, this thing might have now evolved into panic disorder. So panic attacks are accompanied by agoraphobia, when someone avoids or endures specific situations, basically, such as being outside the home or being in a crowd or standing in a line. So agoraphobia is usually associated with the fear of being outside around other people. So panic disorder usually encompasses agoraphobia within it. So some of the cognitive symptoms of a panic attack, basically the things that are going through your mind is, oh my gosh, I'm having a heart attack. Thoughts like I'm suffocating and I can't breathe. That's something that when we hear, we immediately think this person could possibly be having a panic attack. And then the physical manifestations of a panic attack can include accelerated heartbeat, chest pains or chest discomfort, dizziness and nausea, trembling or shaking, and shortness of breath as well. The behavioral symptoms that can be associated with a panic attack include the avoidance of places where the person had the anxiety symptoms in the past. So if I was in a shopping mall before, and that's when I started feeling these feelings of anxiety, my behavioral symptom would be then to avoid all such places that signify that mall or that actual mall in itself. Another behavioral symptom is avoidance of traveling, of malls, and of lineups. So there, that agoraphobia is coming back in. I'm avoiding any places that are social or places where I can be around other people because I'm not able to cope, basically, with being around other individuals or in crowds, basically. And then another behavioral symptom of a panic attack, surprisingly, is avoidance of strenuous activity. So sometimes things like exercise, even, it's something that I can avoid. And that's a behavioral symptom of panic disorder, because in my mind, I'm thinking that if I exercise, I can run out of breath, and that can easily trigger another panic attack. And if you remember, we said, Uguti, when it becomes panic disorder is when I spend another month after the panic attack worrying that I'm going to have another panic attack. And so that's for me, the main thing about panic disorder is that it's not the panic attack that makes it panic disorder. It's the worrying about having another panic attack that pushes it into panic disorder. And ironically, the thing with that is the consistent worrying about having another panic attack triggers a panic attack. And so it just becomes a cycle where I'm having a panic attack, I'm worrying about having a panic attack, which causes me to have another panic attack, and the cycle just continues, basically. The next phobia I'm going to talk about, or the next anxiety disorder I'm going to talk about, is a specific phobia. So it's called specific phobia. And a specific phobia basically involves a marked or persistent fear of clearly discernible, circumscribed objects or situations. So there are 5 subtypes of specific phobia, and these include the animal type, such as a fear of mice or even dogs, like the same example we had made before. There's natural environments type, which includes fears of storms or heights, natural disasters. Then there's a blood injection type, which is basically a fear of seeing blood or receiving blood because of seeing the needle. Another type includes a situational type, where the fear is based around the fear of public transportation or enclosed spaces, and other types, which is then called the fear of choking or vomiting. So the cognitive symptoms of this specific phobia is things like, oh my gosh, I can't get into this plane because if I do, this plane will crash. It's a phobia that is basically triggering anxiety and resulting in an anxiety disorder. Then the physical manifestations of these phobias are a part of the general symptoms of anxiety. You have sweating, you have muscle tension, and you also have some dizziness as well. Then the behavioral is like all we've been saying before. So you then avoid these places where you felt the panic initially, and you basically change your day-to-day routine. Your daily living is basically interrupted by the phobia of this thing. The next phobia that we're going to talk about, which is under anxiety disorders, is called social phobia. So social phobia basically involves a marked or persistent fear of social or performance situations in which embarrassment might occur. So if you think about okay, I'm gonna go walk outside, but there's steps there, and what if I trip and fall? So it's now you're afraid of any social situation where you're going to be around other people, and there's a possibility that something embarrassing might happen. That being said, there's no guarantee that it might happen, but the anxiety is caused by worrying about something embarrassing happening. So an example of the cognitive symptoms include thoughts or people will think that I'm weird or people are going to laugh at me, and there's no necessarily cause of those thoughts or fears. And then the fears might be associated with any social situations which are related to public performance or social interactions, such as participating in small groups or meeting strangers, sometimes even dating or playing sports. So basically, any activity that involves you socializing with other people, which is causing you to have excessive anxiety or fear. Then the physical manifestations of this as well are some of the other symptoms that we talked about under anxiety, such as blushing, sweating. Sometimes you can even go as far as having a dry mouth as well as dizziness. Then the behavioral are again avoidance of social gatherings, parties or meetings, as well as the avoidance of public speaking. So here, basically, you are getting to a point where you are making sure that you're not involved in any activities that require you to be associated with anyone else. So it can go as far as being one or more people. So if I'm going to be in a situation where I have to be around another person, I can't do it, and I'm avoiding these situations. And there we really see how our lives are impacted, because it's almost on a day-to-day basis that you have to interact with other people, because nobody's an island. We're not isolated. So I think that's a really big um, anxiety disorder, is because you're now failing to socialize with other people, and especially depending on your age group, there's milestones that are associated with socializing with other people, and you're unable to reach those milestones and develop the way you should because of the anxiety that you associate with them. The next anxiety disorder that I'm going to talk about is obsessive compulsive disorder. This one is very close to my heart because I have seen the most with it. So obsessive compulsive disorder is a disorder that involves the recurrent obsessions or compulsions that are severe enough to be time consuming or that are caused by marked distress or significant impairment. These obsessions are uninvited or intrusive thoughts, their urges or feelings, as well as images that might pop into your mind over and over again, such as concerns about contamination. So, for example, if I touch the door handle and now I'm like, I'm sure somebody else touched that door handle. Now there's germs. I need to go wash my hands. And then I wash my hands. Then I go back and I'm like, I feel like maybe my hands might still have some of those germs. I need to go wash my hands again. And then it becomes a cycle and a cycle and a cycle. And the important thing to note about OCD is, I think, generally there is a lot of stigma around mental health care issues, or mental health issues rather. And the stigma is that people think that people who are experiencing these mental health care issues have the power to basically make themselves stop. And with things like OCD, which is the obsessive compulsive disorder, it's important to note that these things are compulsions. So something that is a compulsion basically means that you feel like you have to do it. It's not something that you have control over. So once you get that compulsion, you have to do it. And why this is an anxiety disorder is because the longer you don't do it, the more the anxiety builds. But the trap with this anxiety disorder is that when you do it, what you're doing is you're reinforcing that behavior, and it becomes the only thing that can basically dissipate or lessen that anxiety. So again, it creates a cycle where I need to do this thing. Maybe I have to wash my hands. If I don't wash my hands, it builds anxiety within me. And then I'm like, you know what? Okay, I can't deal with this anxiety. Let me go wash my hands. Okay, cool. I go wash my hands. What that is teaching my body or my brain is washing my hands when I have that compulsion is the only way to get rid of that anxiety. So it reinforces that behavior, which is negative, which is not a behavior that we want. And then we end up in a cycle where if I don't wash my hands, I feel anxiety. But if I do, it reinforces the fact that washing my hands gets rid of the anxiety. So I do it again. And it eventually becomes a cycle where I'm doing all of these compulsions, which I don't want to do because it's not fun. It's not something we do. Oh, I just want to be clean. It's genuinely a thing of I am unable to control these intrusive thoughts that are coming into my head. I'm unable to control these intrusive feelings that are coming into my head, and I'm unable to control these compulsive thoughts that are just popping into my mind. And the only way to get rid of the anxiety that is causing them is to basically do a certain behavior, which then gets to a point where it's interrupting your daily living. So it takes time out of your day. You are at a point where you even, I know I've had cases where I'm speaking to, they're basically explaining to me that, um, excuse me. Okay, so they're basically explaining to me that they are taking 5, 6 hours out of their day just to do compulsions. And that 5 and 6 hours, that's time that they usually spend with their family. It's time that they usually be doing schoolwork, time that they usually be socializing, but they're unable to do this anymore just because of these compulsions. So yeah, I think that's it's one of the more, for me personally, my opinion is that it's one of the more difficult anxiety disorders because it really is time consuming and it's very intrusive. It's kind of, I think the best way to say it's a very cruel anxiety disorder. The next disorder is acute stress disorder. This acute stress disorder can occur after someone has experienced or witnessed or was confronted with an event or a number of events that involved actual threats or threatens death or serious injury or the threat to physical integrity. So that basically means that I was in a situation where, okay, maybe I was held at gunpoint, it's a robbery or something like that. And that acute stress disorder then is triggered by that experience. So this disorder usually occurs within 1 month of a traumatic event. So if I experience this traumatic event today, usually within 1 month of that event, this is when the acute stress disorder is then triggered. And what happens here is basically the disturbing memories of that traumatic event cause an emotional reaction and a sense of reliving the event. So it's one of those situations where you find people saying it's like they were experiencing that shock, that trauma all over again. That's just how intense it is. It literally feels like they're being transported back to that time where they were actually living in that moment. And so examples of the thoughts that may occur to these people when they experience that acute stress disorder are thoughts such as, I've escaped being killed once. I won't be so lucky the next time, The world is not safe for me. I can't go outside. Things such as, I'm going to be trapped and die in this car crash, Those are some of the thoughts that these people might be having. And then the physical manifestations of acute stress disorder include restlessness, difficulty in sleeping and concentrating, exaggerated startled response, and feelings of tension or being on edge, as well as feelings of being numb. So, some of the behavioral manifestations of this, which are caused obviously by the physical and cognitive symptoms, include things such as the avoidance of situations that may cause recollection of that trauma that they experienced, as well as intense emotional reactions or absence of emotional responsiveness. So, what this means is if it was a curved road that I was on the day that I got hijacked, anytime I go on a curved road, it instantly transports me back to the incident of the hijacking. And so what I'm going to do in order to avoid that stress is avoid any streets that have curves. So if it means I must travel twice the distance to get where I'm going, that's what I'm going to do, as long as I am not going on that road, or any road rather, that is curved and that it might trigger the response, or the the transportation basically of me mentally back to that situation that I was in. The next stress disorder we're going to talk about is post-traumatic stress disorder. And I think we've heard a lot about this disorder. That being said, I'm not sure if we know a lot about it. I know we hear a lot of different a lot of different mental disorders, but most of the time we don't really understand what is meant by this. So post-traumatic stress disorder involves the development of characteristic symptoms following the exposure to an extreme traumatic stressor. So what this explanation basically is saying is that PTSD is something that causes almost like an automatic and recurrent response anytime you're exposed to something that is similar to the actual event that caused the trauma. So, for example, if I was involved in a car accident and it was a loud bang before the taxi moved forward and I was caught in the crossfire, whatever, anytime I hear a loud bang, my body will twitch. And that's basically like a very light description of what PTSD could be. So anytime I hear a loud bang, it could be somebody shutting the door. It could be a firecracker going off. Anytime I hear that sound, my body is instantly just going to jerk, because my mind, my subconscious associates that sound with the traumatic event that I experienced at the time. So the person's response to the event must involve intense fear, helplessness, or horror. So when you experience this jerking of your body after somebody has shut the door, it's not just like, oh, the door is shut and then I shake and then, okay, life continues. It's somebody shuts the door and immediately I am trembling, I'm shaking, I'm feeling dizziness, nausea even, because in my mind, my subconscious is taking me back to that event and I'm re-experiencing the trauma that was associated with that event all over again. So the symptoms usually begin within 3 months of the trauma, although there can be a delay of months, because obviously each individual is different, and even years sometimes before the symptoms appear. So just because you have been in this traumatic event and it's been 3 months or even 4 months, and then you start experiencing symptoms of PTSD, it doesn't mean that it's not PTSD. So usually, for most people, it happens within 3 months of the traumatic event, but it's important to note that it can take months or even years for those symptoms to appear. So it doesn't mean that you're not experiencing that. It just means that you are able to, or your mind was able to bury it in your subconscious for longer. So the traumatic experience is usually repeatedly relived through intrusive memories, distressing dreams, or flashbacks. So if you're finding that you're always having that same dream of the traumatic event, and every time you wake up, you're shaking, you're screaming, or even I've had cases of patients who are in their dream, they're dreaming about this traumatic event, and they're actually reacting in their dream. So you find that they might be sleeping, or they're suddenly awake, and all of a sudden they start fighting the people around them, and nobody really understands to be like, how? So when in actual fact this person has PTSD, and their body is having an automated response to the trauma that they experienced, and it happened through a dream. So your mangalukusi, how this person just woke up now, they're fighting everyone, but what actually happened is they're going through, they're reliving that traumatic event that once happened to them. So some of the thoughts or cognitive symptoms associated with PTSD include thoughts such as thinking things like, I now realize that I'm never going to be safe, or people can't be trusted, everybody's out to get me, those type of thoughts. Then the physical manifestations or symptoms of PTSD include sleep disturbances, especially and nightmares, the irritability of people, like the increased irritability. Sometimes people are just irritable because that's just who they are, but it must be a marked increase in irritability in the person, as well as outbursts of anger, and then hypervigilance for danger. So this person can't even go outside without double checking 3 times around the house that there's nobody there, that everything is safe. So even the littlest, smallest things, they're just always hyper aware. They're always hyper vigilant of danger around them. And then the behavioral rather consequences or symptoms of PTSD include the avoidance of thoughts, feelings, conversation, activities, places, or even people associated with the trauma. So if it's that I went through this traumatic event with my friend, all of a sudden I'm avoiding seeing her. I don't want to talk to her. I don't want to know anything about her. Not because, I feel some type of way about her, but because every time I see her, I associate her with the trauma that I experienced, and it's something that I'm not quite able to handle yet. We're gonna go and move on now to generalized stress disorder. This one is it's very prominent. So it's a stress disorder that a lot of people have, and they don't even realize it because it's very generalized. They're not having specific phobias, or specific anxiety disorders. It's very generalized, the generalized stress disorder. So how this is defined is it's basically involves the excessive anxiety or worry occurring more days than not for a period of at least 6 months about a number of events or activities. So what this is basically saying is you are excessively worrying every day or most days of the week, more days than you're not worrying. You're worrying, you're worried, and you're just worried about anything and everything that there is to worry about. So you are thinking, yo, okay, I must go have breakfast. Now you're worried about is there bread or not? Okay, cool. Okay, fine, there's bread, you eat bread, you go outside, and you're like, okay, I must get to school. Yo, now I'm worried about, am I gonna even get a matex? How am I gonna get to school? So every little thing that there is to worry about, you're basically worrying about. And there's no necessary cause for you to be worrying about this. And that's why they call it generalized. It's generalized because you're not focusing on a specific fear or specific worry. It's basically everything that can worry you is worrying you and happens more times than not during the week. So the cognitive symptoms associated with this or the thoughts that you might have include things like something's going to go wrong. I know something is just not going to work out. Something bad is going to happen today. I can feel it. And those are the thoughts that you have, but you have them every day. So it's a constant thing of every day you're worrying about something going wrong. You're worrying about something bad happening to you or your family members. And then also some people have thoughts like this worrying is going to drive me insane because it's taxing, it's stressful to get to a point where you are worrying about everything and it's tiring for your mind as well, I've even had some patients who come across to even be like they have excessive thoughts about worrying about death. So whether it's like, okay, I feel like I'm gonna die, or my family members are gonna die, somebody I know is gonna die, my friend is gonna die, and not necessarily because they're sick or anything. It could be that maybe your next door neighbor passed away, and now you're worried about everyone in your life passing away. It's those type of things. So the physical symptoms that are associated with generalized stress disorder include muscle tension. They include the inability to relax. They include restlessness and irritability, as well as sleep disturbances because of worrying. The behavioral symptoms include the avoidance of news, newspapers, anything that can basically bring negative news, as well as restricted activities due to worries about what could happen. So usually you'd exercise, but now I'm not going to go exercise because what if I go exercise and then this weight falls on my head? Next thing I have a concussion and I die, And sometimes these worries are not necessarily realistic, or let me not say realistic, they're not necessarily they're not very, I don't know how to say, the likelihood of them happening is very low, but you can't help worrying. So basically I've covered the 6 major types of anxiety disorders. Yeah? And then people always ask questions like, but what is causing this anxiety in my life? I don't feel like there's anything I should be worrying about. Why am I worrying? And there's a variety of things that causes anxiety. Usually it's things such as stressful or traumatic life events. It can also be because of your genetics. So you can have a genetic predisposition to anxiety. So basically you have a family history of anxiety. People in your family just generally have anxiety. It's just one of those things. Also, things like childhood development issues might cause anxiety. So if you look at the psychology behind that, things like attachment, um, you know, basically not meeting your milestones. There's a lot of childhood issues that you may experience, obviously, when you're a child, that can cause anxiety. Also, things like alcohol, certain medications, or illicit substances, which is basically drugs, can cause or spark anxiety, um, especially if you're someone who's already predisposed to having anxiety, which basically means you're more likely than other people to have anxiety because of either childhood development issues or just having a lot of people in your family who have anxiety. So those things can really spark it off and basically start the train for a whole range of anxiety disorders. But also, it's important to know that other medical or psychiatric problems can also elicit anxiety, you know? So I think, especially in this day and age, it's important to note that things such as like substances, basically, so your alcohol, your cigarettes, your weed, your whatever drugs that you are basically exposing yourself to, they have the capacity, and in most cases, where I've been working or where I have um, worked with psych patients, which are basically people with mental health disabilities. 90, about 95% of all the people that are there because they somehow were using substances, and those substances were the precipitator, they were the spark of those mental health disorders and even things like anxiety. So yeah, that is basically what I had prepared for you today. Again, I need to reiterate that if you do suspect that you might have any type of anxiety disorder or any other type of mental health disorder, it's important that you consult a medical professional because, like I said, we're not really qualified here to be making diagnoses, rather. But consult your mental health care provider, and they have the relevant tests to do. They know where they need to refer you, and you'll get to where you need to be for you to have those proper assessments. And from that point, you'll be able to get what you need to make you better, to improve your mental health, and overall just improve your life. Because if your mental health is not okay, there's no way that you're functioning at your full capacity, and there's no way that other areas of your life are not affected. Yeah.
Yo, you have said a mouthful. You have said a mouthful. You said a mouthful. Yo. Like, some other things I thought I knew, because sometimes I just, when you're doing just for reading, I'm like, yeah. Some of the things I never knew, like, especially when you talk about things that are, that when you make an example, I'm like, wow, okay. I must just maybe go and check it out. I don't know. maybe there's somebody there who's saying that I just want to go and check it out and see what's happening. But I think I have a question here on the comments before
Definitely,
we
definitely.
before we close the question. I hope you can read the question. Can you see the question?
Yes, I can. So the
Yeah,
question says, I don't know if everyone can see it, but the
yeah.
question is, oh, okay, so it's basically asking if panic disorder is physiological. So panic disorder, all of these disorders, they are mental health disorders. Anytime I made reference to something physiological, what I mean is you have physiological manifestation of the mental health disorder, or you have physiological reactions that are occurring in your body that then cause physical manifestations. So, for example, you have something physiological happening would be, okay, I see this dog. Okay, cool. Now I'm scared. The physiological response is the fear causes the release of adrenaline. Adrenaline will then go and make my heart pump faster. Now I'm having heart palpitations. You see, that is a physical manifestation. It's a physiological process, but the disorder is a mental health disorder.
Okay. And there's another one. I'll just pop it up there.
Okay. I
Mhm,
had this here. I'm gonna tell you now.
mhm,
I think I had it here.
mhm,
All right. Let me just.
mhm.
So you have specific phobias. Okay, so it's basically called natural phobia. Okay, so the thing is, with these phobias especially, there's a lot of different names for it because there's been a lot of different classifications. There's the DSM, which is basically a manual that names all the different mental health disorders and gives you the categories that you must basically fill, for lack of a better word, in order for you to have that specific mental health disorder. So that one is called natural environment type phobias. Sorry, not natural phobias. Natural environment type phobias. So you are scared of things in your natural environment, like I said, storms or heights, natural disasters, that type of thing.
Oh, okay. I see. Okay. I think we were having a great one. Due to when I understand this thing about there are different types of things that can be like they can be symptoms, and that's
Mm,
that's that's something that I see. Like you sometimes you must just if you're not sure, go and find out. Because sometimes
definitely.
because you're speaking, I'm like, yeah.
I
And
have all of
sometimes
them.
literally I have all of them. So now I just want to say to those who are saying that, okay, fine, I think that I might be having a certain thing. No, just go there, consult and see what is
Mm,
it really
mm.
true? Is it really true? Do I have it or don't I have it? So that it makes life more easier. You were able to know, okay, fine, if then and even the person will give a way forward. Now do this, now do
Mm,
this, and
mhm.
you'll
And
be okay. Mm.
definitely you'll be fine. And like I was saying, the DSM is the one that basically qualifies whether or not it is a mental health disorder because there's specific symptoms that are more specific than the ones that I've given that they use to categorize it. We'll say, okay, is this just, life? Because life is hard, guys. Or is it mental health care? Mental health issues.
Mm.
Also, I just feel the need to just last point. Sorry, guys,
Yeah.
I know I talk about that, especially during this pandemic, ne? A lot of people with mental health disorders have been going through a lot because whether or not you are actively aware or actively being stressed out by the pandemic, all mental health disorders are being more exacerbated by this pandemic. So what that means basically is, especially for your people with anxiety disorders, if you have anxiety disorders and you found that during this lockdown you're doing things like, okay, all of a sudden now I don't come out of my room, my eating patterns have changed, my sleeping patterns have changed, I'm struggling to fall asleep, or I'm sleeping for too long. Those are things that I associate with anxiety, but they've just been made worse by the pandemic. So if you are suspecting that you have mental health care issues, it's or mental health issues rather, it is very important at this time that you get it checked out because a lot of people are even having worse symptoms of mental health problems now because of the pandemic, and it's a very subconscious thing. It's not like you're like, yo, really, this thing's stressing me out. I can feel my anxiety going up. No, it's a subconscious thing, and it's happening to a lot of people all around the world, and we just need to take care of ourselves.
Yeah, that's very much true because I always say this pandemic has brought the weakness. It's taken like when it has exposed each and everyone's weakness. Like, and I feel to myself
True.
as well because on my side personally, it has made me to do things. For example, to overwork. And it leads to
Mm,
a lot of problems. So now, to those who are having a problem, especially during this pandemic, just know that if if it was not a pandemic, it was maybe you were not sure about it, but now because now you are with your family or you are with a particular because sometimes there are people we are not used to be with our families for such a long time, and during the
true.
lockdown
True.
we experience different characters, and it becomes a problem. It becomes a
Yeah,
huge problem,
definitely.
and after we see that, then it becomes a problem. Then you need to deal with it. You need to deal with it. So yeah, I think that's a comment. Ne? I think that's a comment. Mm, I think that's a comment. Yeah.
I can't stand comedians be in a picture. Okay. Okay, so again, like
We're
it,
left
it
in
is
five
really
minutes, please. Yeah.
it is one of those things, and I think yours would be classified under the animal type phobias. But also, again, I'm not making diagnosis, so it could be something totally different. But if it is that it is an anxiety disorder, then I would think that it would be under the animal type phobia. But then again, you have to go into like a whole extensive, research to be like, why are you feeling the way that you're feeling about chameleons? So like I said, if you're suspecting that you're not all like 100% okay with your mental health or your mental wellness, then definitely get it checked out.
Yeah, they need to go and check it out. So yeah, man. Maxine, I just want to say thank you. I don't have questions right now, but I'm still diagnosing myself. I know it's wrong, but but I know it's wrong, but it's very wrong. But I just want to say thank you for everyone who has joined as we run out of time. I know people were saying, "Where's Nokolo? Where's Nokolo? Where's Nokolo?" Nokolo is within. Yeah, no, she's here. She's here somewhere. And due to time, we're going to have her tomorrow, and we're going to have Maxine hopefully tomorrow again. I don't know, but I don't want to give out all the secrets out. I can't do that. I can't do that. But from my side, I just want to say thank you very much, Maxine, for blessing us, with such information, because we're living in a time whereby information like this, we don't take it serious, because we live in a society whereby when somebody has such a thing, we think that person is crazy, that person, or he smokes something, yeah, I want to pay something, but that's not the case. No, there are technical things that if you go and consult, it is possible for you to treat them. Yes, for you to treat
Definitely.
For you to treat them.
Also, I just want to say, if there are any more questions, even after this is done, I'm sure that you can leave them in the comments and we can address them tomorrow as well.
Yes. Please do leave your comments. And Mos, we will try our best to get back to you, and we will get back to you because we're all about
Definitely.
people understanding. So thank you very much, Maxine, and may we all have a wonderful day. Oh, it's an evening. Wonderful evening.
Yes.
Wonderful evening. Wonderful evening. Thank you very much.
Thank you so much for having me. Thank you.
All right.